Hi Mama, I'm Katie. Welcome to this video. Usually I do daily workout videos that focus on strengthening the body, stretching it, mobilizing it, as well as preparing for birth. So throughout the whole pregnancy, I make daily prenatal workout videos where we do a workout to prepare our body for the changes that are coming in pregnancy and make space for baby and prepare for baby and labor in the future. I also do developmental videos about what is happening in each week of pregnancy to baby, as well as what is happening to mama. I talk about the pregnancy symptoms and give some tips and tricks on how to alleviate some of these symptoms where possible. But today's video is going to be about gestational diabetes, so about pregnancy diabetes. Let's start with asking the question, what is gestational diabetes? It is a type of diabetes that develops in pregnancy, and it can develop usually, most probably, in the second or third trimester. And it means your body cannot produce or use insulin efficiently. And this leads to high blood sugar levels. Now, some women develop it and some women don't develop it. And the question is, why? Is there some factors that some are more prone to developing it? So during pregnancy, hormones from the placenta make your body more resilient to insulin. And some women's bodies cannot make enough extra insulin to keep the blood sugar levels normal. And that's why glucose builds up and the blood sugar levels go up. Now, who is more prone to this? Women that before getting pregnant were overweight and during pregnancy sustain this higher weight. Women who have family members with type 2 diabetes, so if they have a history of diabetes in the family, they are more prone to developing it in pregnancy as well. Also, if you were pregnant before and you had gestational diabetes in your previous 1-2 pregnancies, then the chance of you having it in the next pregnancy is also higher. And one last kind of factor is that if your baby is big, so if your previous baby was 4+ kilograms, this is an indication that the current baby might also be bigger, more than 4 kilograms, heavy, or if you have a complicated pregnancy and birth. Now the question is, can it be prevented? Is there something that I can do as a pregnant person to not develop gestational diabetes? Because if you do have it, this will have some consequences and you will have to adapt your lifestyle. So let's ask the question if there's something we can do to prevent it. I'm a big fan of prevention. So as we said, some women are more prone to it than others, and therefore it's not always possible to prevent developing pregnancy diabetes. So some women have it because of their family diabetes history. Even if you have a super healthy lifestyle and you work out and you eat healthy and have regular meals and keep your blood sugar levels stable at all times, you might still develop it nevertheless. But you can reduce the risk of developing it if you indeed have and maintain a healthy lifestyle before getting pregnant and eat healthy foods and have a healthy diet which is rich in protein, rich in fiber, rich in vegetables, low in fats and sugars. So sugar is the main culprit here. Staying active during pregnancy and then in the first weeks also definitely helps to normalize these blood sugar levels and therefore helps with prevention of developing gestational diabetes. and avoiding excessive weight gain in pregnancy. So every person is different. You might be gaining more weight faster than the norm. There is nothing normal in pregnancy, so please do not worry about that. I was slightly concerned at one point when in the second trimester my weight suddenly shot up like crazy and I was like a balloon. But that was just normal. And the baby is healthy, and now in the last weeks the weight gain has also gone down. So yeah, it is important to move and be careful of what you eat for sure. So when and how is it tested for? So like we said, it develops in the second or third trimester, and therefore the glucose diabetes test in pregnancy is usually taken around week 24 to 28. So with the end of 27 weeks, we reach, or when the 27th week starts, we reach the third trimester. So this is at the end, towards the end of the second trimester, it is tested for. And which way is it tested? Usually you are asked to fast overnight and come in the morning to the doctors to do some tests, a round of tests. So the fasting time is minimum 10 hours. So in those 10 hours, you cannot eat or drink anything apart from water and herbal tea. And then you go to the doctors and they first draw some blood and measure your fasting glucose, it is called, and then see the blood sugar levels there already. And if they are already too high, they might tell you, therefore, that you have gestational diabetes and nothing else needs to be done. If those levels are within the norm, you will be asked to drink a very, very sweet, full of sugar drink. That's around 200-300 milliliters. Within 5 minutes, and this is very hard to drink because it is so sweet, you're not allowed to eat or drink anything else apart from this one drink. And then your blood will again be drawn 1 hour after taking this or drinking this drink, and then 2 hours after drinking this drink. And in each test, they will tell you whether you are above a certain level and therefore indeed probably have gestational diabetes, or whether you are to come back and do the third round of testing. And then again, if it is too high in the third round, even if the first and second round were fine, this is still an indication that you have gestational diabetes and need to take some measures. But if in all 3 tests your blood sugar levels are below a certain amount, then you're fine, which is the best case scenario. So it is great if you don't have it, because you don't need to make any changes in your lifestyle, in what you eat, how you move, what your day looks like. However, if you do have a positive result and therefore the doctors will tell you, yes, you do have it, you have developed it, then some dietary changes for sure will be needed, and they will give you some tips about this. The most important ones are to have small balanced meals throughout the day. So not a massive bowl of rice, but something small and nice and diverse, so that the glucose doesn't spike in your body. And unfortunately, no sweets are allowed. So no chocolate, no snacks, nothing with high amounts of sugar is allowed. Then exercise is something that you will have to start doing if you haven't been doing it. And then the light to moderate activity is definitely recommended. So this could be joining my workouts daily or 2 or 3 times a week whenever you have the time. They are usually not too hard. There are a few tougher ones in there as well, but usually it is this moderate kind of training activating the whole body, as well as walks, going on walks, swimming is also recommended. You will probably need to monitor your blood sugar levels, that they indeed stay stable, and that you're not going into a spiky territory. And potentially medication might also be needed. So maybe you'll need to take some insulin. But if you start working out, if you haven't before, as well as have a healthy, balanced diet with small meals and no sweets and no sugars, then this should be enough. Now the next question a pregnant mom with a baby developing in their belly will ask is, does it affect the baby developing inside me, right? If I have it, then does this mean that does the baby also have it? The answer here is yes. So if you do not do anything about it, it will affect the baby. So that's why it's super, super important to indeed start taking a little bit more care of yourself and take it seriously. So what can happen to baby? Baby might grow too big, too large, and too soon. And therefore there's a higher chance of preterm birth, or complications during delivery, or complications during pregnancy itself, as well as breathing difficulties may occur in the future, and the risk of low blood sugar level after birth. So it does have an implication on the development of the baby and the health of your baby. So definitely treat this seriously. The next question that a lot of women ask is, does this affect the type of delivery? So if you are planning a C-section, if this is possible in your country, then this is completely fine. If you are planning a natural birth, a vaginal delivery, it could be affected. It is often possible, and a lot of women with gestational diabetes do have normal, natural births without any complications whatsoever. Nevertheless, if the baby grows too big, the doctors might decide to induce labor earlier than the due date, or might suggest having this C-section. So there is this possibility. So also I've heard that if baby, depends on the country where you are living, but if baby doesn't come by the due date, then the labor will be induced. So normally when we're waiting for our babies to arrive, an accepted amount of time that they can go over the 40 weeks is around 10 days, 12 days, 14 days. However, if you have gestational diabetes, doctors will most probably recommend to either have the C-section or to induce labor by that date. Does gestational diabetes stay for life? Do I always have it? Since I've developed it now, will it stay? And the answer is it usually goes away after giving birth, after a few weeks. Nevertheless, because of some family history, and if your family did have or does have type 2 diabetes, then therefore you are more prone to having it after delivery as well. So this is something that you will then have checked after giving birth within a few weeks. The blood sugar levels should go down to normal. However, there will be a test again that you will do to see if that is indeed the case. And this will happen around 6 to 12 weeks after giving birth. And it might be recommended that you again test every 1 to 2 to 3 years to make sure that you are not developing type 2 diabetes. But in most cases, it does go away after baby is out, just like a lot of other pregnancy symptoms. So that is it from my side for today about gestational diabetes. I hope it was informative. I hope you know not to worry. It is something that can occur. Some people are more prone to it than others. Most probably you will go back to normal after pregnancy. most probably you will have a nice and healthy baby and everything will be as planned. So I keep my fingers crossed for you that you don't have it in the first place, but if you do have it, please don't start worrying, and everything will be fine. So I hope to see you join me in the next days and weeks in the workout videos that I release daily. And if you enjoyed this one, click the like, click the subscribe. Tell other mama friends about the channel as well to join in this great pregnancy challenge together. Thank you for joining today and see you soon. Bye.